A very good morning and a warm welcome to all our esteemed guests and to dear learners. I am Dr. Ria Tukral from the Homeopathic Academy, and we are here today to discuss a very interesting topic with Dr. Saptarshi Banerjea. We have Dr. Banerjea live with us right now. But before we go ahead with this webinar, for those who don't know about the Homeopathic Academy, let me quickly introduce ourselves. So, the Homeopathic Academy, or THA as we call it, is BGen's effort towards digitalizing homeopathy and providing a platform for quality education online. THA offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at UG, PG, UPSC and CME levels. All these courses are enriched with state-of-the-art audio-video technology, text and vector animations, giving you an HD quality audio and video experience made by a dynamic team of qualified doctors, video editors, and many more professionals. These courses will perfectly complement your studies to make learning an extraordinary experience. On your screens, you can see some of our courses currently streaming on our website, www.thehomeopathicacademy.com. You can also see the course on learning the art of rapid classical miasmatic prescribing by Dr. Saptarshi Banerjea. Here, Dr. Banerjea will teach us how to include miasms in our homeopathic prescriptions. He ensures that with proper application, miasmatic prescribing can uproot the underlying cause of disease and nip the bud of increased susceptibility to future diseases as well. So don't miss out on gaining this wisdom. Enroll in Dr. Banerjea's course at our website. So, coming back to this webinar, Dr. Banerjea, can we please have you here with us? Yes, hello. So we have him right here with us. Good evening, sir.
Good evening.
So let me introduce Dr. Banerjea to you all. So, about Dr. Saptarshi Banerjea, he inherits his clinical acumen and wisdom from his illustrious father, Dr. Subrata K. Banerjea. Being the fifth generation homeopath, Dr. Saptarshi has inherited the wisdom and homeopathic heritage of over 100 years. He finished MD with specialization in Materia Medica. The Calcutta Homeopathic College awarded a gold medal for his first position in All India MD entrance examination. He holds postgraduate workshops in Malaysia, Bangkok, and Tokyo. He is a lecturer at Allen College of Homeopathy, England, Bengal Allen Medical Institute, which offers international programs for overseas homeopaths frequently. He has published some books and articles and research papers like Scope of Traditional Small Medicines in a Drug-Dependent Pathology of Cholelithiasis, Comparative Materia Medica of Lesser-Known Medicines for Destructive Aggression, and also Meeting Materia Medica. So that's about our illustrious speaker today. So thank you so much, sir, for being here with us. And before I hand over to you, let me explain to our learners how this interface works. So on the right-hand side panel on your screens, you have a short chat box. You may type your questions or whatever message you have for Dr. Banerjea right there and press the button next to it to send it to us. I request you all to send your questions only after Dr. Banerjea's lecture is over, as that might disturb him and we wouldn't want that. So without wasting any more time, over to you, sir.
Thank you for the wonderful introduction. Good evening, everyone. Those are joining in from the subcontinent. Good afternoon, good morning if you're joining in from overseas. We have two very interesting topics to share with you today. I'm going to talk about osteoarthritis and especially miasmatics of osteoarthritis, so that you can handle drug-dependent cases. And along with that, I'll be sharing with you a very interesting case of Hashimoto's thyroiditis, autoimmune thyroiditis, where miasmatic treatment as well as totality helped in the prescription. So I'll be emphasizing more on the miasmatic component here, and obviously I'll be covering the remedy differentiation, the comparative Medica as well as I go ahead. So without further ado, I'd like to start off. So I'll be sharing with you a very interesting case of Hashimoto's thyroiditis. And you understand that I've inherited miasms from 4 generations. Just a quick heritage, how miasm came into a family. My great-grandfather, Dr. Kishori Mohan Banerjea, and N.M. Chaudhary went to study homeopathy in America. N.M. Chaudhary went to study from Kent. I'm sure you have heard about N.M. Chaudhary's Medica, those who are joining in. And my great-granddad went to study miasms from John Henry Allen. So they got best of both worlds. So they learned miasms as well as learned Medica, came back and started Bengal Medical College in Calcutta in early 1920s. And you understand, I'm sure, about the 3 great miasms of Hahnemann, Sora, psychosis, syphilis. But it was John Henry Allen who implemented the pseudosora or the tubercular miasm. And we have kept on that heritage of John Henry Allen of implementing tubercular miasm into our prescription. And I'll be sharing with you how that lineage has gone down to my granddad, to my dad, and finally to me. And my friends, as I'll be sharing with you about the details of the course later on, and miasmatic prescription, to some people it may look like, back off, I don't want it because it's complicated. But the course which THA has organized, as well as which I'll be sharing with you a fragment of that today, is to emphasize that belief miasmatic prescribing is easy. And at the end of the day, what I can do, you can do as well. So keep that belief, and you have to understand that miasmatic prescribing and symptomatic prescribing are 2 sides of the same coin. You cannot have one without the other. So symptomatic totality and miasmatic totality are 2 sides. 50% is symptomatic totality, 50% is miasmatic totality. You cannot have one without the other. So you have to implement miasms in your practice. So we'll start off with the case of Hashimoto's thyroiditis. This was a middle-aged man, age 55, whom I'd seen in our Calcutta clinic. And initially he came to us with tenderness of the thyroid gland. Left side was more painful. Pain was worse at night and lying on the affected side. So it was sensitive, you can understand that. Pain started gradually since last 6 weeks, so it was not really acute, but it had gone on for about a month and a half. And sometimes the pain used to extend from the thyroid gland to the head occasionally. So there was some radiation of the pain at that point of time. Now, whenever you think of miasmatically, thyroid gland, glandular enlargement, tender and painful, do always remember, and we have shared this in the course in details, that whenever you come across glandular enlargement, there's a scrofulous diathesis. And whenever you encounter scrofulous diathesis, it's a part of tubercular miasm. So you have to consider a tubercular prescription whenever you're thinking of glandular medicines, or whenever thinking when the present complaint is glandular enlargement. In this case, it was worse at night and worse lying on painful side, so sensitiveness was there. I had a feeling of obstruction in the throat when swallowing, slight rise of body temperature, so there was some degree of inflammatory changes, polyuria, Polyuria was there, frequent urination. There was quite a lot of weakness and fatigue, and he was feeling quite chilly, cannot tolerate cold air. So these were the additive factors with him: the chilliness, weakness, polyuria, and a slight feverishness was there. Particular symptoms, nothing very specific here. Bad breath, bleeding gums was there. Sneezing every morning, so that was quite there even before the thyroid enlargement had started. And with the thyroid enlargement, there was hoarseness as well, brittle nails, and used to get recurrent ringworms with itching in the groins, mostly in summer. So these were the additive factors. So even before the thyroid enlargement had started, he used to have paroxysmal sneezing, he used to have this recurrent ringworms. So that had been there from earlier on. Chilly patient, you understood, I shared with you as well that there was chilliness with the glandular enlargement and the feverishness as well. His salty was quite strong. He was thirstless, with craving for hot drinks. Understand sometimes the vitality is low, so there was a craving for hot drinks as well. And polyuria, I already shared that with you earlier on. Past medical history, typhoid, malaria, tuberculosis. So you understand, as I shared with you, even looking without understanding the past history, there was the glandular enlargement, which will prompt you towards thinking of a tubercular remedy. And here you see there was a past history of tuberculosis as well. Mental generals, punctual, organized, quite artistic, fear of losing loved ones, and apprehends a sickness of death. So there was an apprehension and anxiety to a certain extent, but not overtly present. Memory was poor for recent events, and this memory affection had started since enlargement of the thyroid gland as well. So that was about the mentals. If you see the miasmatic dissection here, chilly feeling, they cannot tolerate cold air, though he likes fresh air. Do always remember this, my friends, and we have discussed this in the details in the course, that patient craves for things which makes them sick. And that's a feature of the tubercular miasm. So I like sweets, but you know always sweets makes me sick, like arginate. I love fresh open air, but whenever I go into the fresh open air, I get a cold, calcaria carp, pulsatilla, sulfur. So they cannot tolerate cold air, although they crave for fresh air. Do remember, they crave for things which makes them sick. That's a tubercular miasm. And that sometimes stems up from the dissatisfaction. That, you know, I'm dissatisfied with what I have, and I crave for things which makes me sick. I've shared this earlier on as well in earlier sessions, that tubercular is a combination of psora and syphilis. So you have a combination of psora and syphilis in the tubercular miasm. And whenever you come across the weakness, fatigue, hypoenergy, lack of energy, lack, scanty, psora, and that is featured here. Point number 2. Recurrent ringworm. I'm sure, my friends, across the subcontinent, you'll come across cases of ringworm. Always do remember it's a psychotubercular miasm. Why psychotubercular? Circular patches, you know, circular alopecia, circular pattern of psoriasis, circular skin lesions. Always do remember you have to think of a psychotic remedy. You have to prescribe a psychotic remedy. And you cannot ignore that, my friends, because you're prescribing on what you see. That is a surface miasm. Somebody comes and presents to you a circular psoriasis, where you have ring-shaped circular lesion, circumscribed lesion, or you have alopecia, which is circumscribed. That is on the surface. That is your surface miasm. And you cannot ignore that. You have to give importance to that. You know, my granddad always used to share that you prescribe on what you see. So that's on the surface. So whenever you come across a case of ringworm as well, do remember the circular patches is psychotic. Why tubercular? It comes back again and again. You prescribe the remedy, gets better, it comes back again. You have to think of psychotubercular remedies. So whenever, if anybody who has done the course is joining in, you'll see that we have a session on miasmatic weightage of remedies, and I've shared which are the prominent psychotubercular remedies, prominent tubercular remedies. So very many times you can come across that and prescribe on the basis of that. Bleeding gums, tubercular. Hemorrhage. Do remember, my friends, all hemorrhages are tubercular. Think of your hemorrhagic remedies. Think of phosphorus. Think of nitric acid as the tubercular features. And that's a feature of the tubercular miasm. Bad breath, you recall again, as I shared with you, tubercular is a combination of sora and syphilis. So bad breath is syphilitic. Brittle nail, again syphilitic. Frequent urination, polyuria, excess, psychotic. Likes net surfing, this is sometimes important. You know, sometimes people go from one site to another. They always like change, and that change, that boredom is always a feature of the tubercular miasm. So I need change, I'm dissatisfied, I need stimulation. So they're always changing from one thing to another, tubercular very strongly. Artistic, creative hobbies, do remember, my friends, are tubercular. I've shared with you in earlier sessions as well that soric hobbies, you know, they will lie down, they will watch the telly, they will watch series and films one after another. Lazy, lack of energy. Psychotic hobby is gambling, I want more money. So out of greed, shopping out of greed, psychotic. Syphilitic hobby is bungee jumping, adventure sports where there is a threat to life and death. That's syphilitic. Whereas tubercular hobbies, remember, all tubercular persons like to come in contact with fresh air. So whenever they're going into the fresh air, they feel better. So gardening, horse riding, whenever there is contact with fresh open air, they feel better. All hobbies. At the same time, tubercular persons like very creative hobbies. So painting, dancing, knitting, floral arrangement, those are tubercular hobbies, and tubercular patients like that. So my friends, sometimes you'll come across cases which are one-sided. You cannot see a good clear picture. Ask about the hobbies, ask about what they like to do. Try and assess the nature of the person and try and assess the surface miasm. And then you can come up with a particular remedy as well. So understanding the hobbies is sometimes really, really useful. Memory poor for recent and past events. To start with the sora, do remember that. But whenever it becomes recurrent and persistent, syphilis joins in. Apprehension of sickness. What will happen to my family? Do remember, my friends, 3 A's: alertness, apprehension, anxiety are sora. So on the sora, you'll find all the fears, and that is a feature of the soric miasm. Thyroid gland enlargement, as I shared with you, is tubercular because of scrofulous diathesis, but enlargement at the same time is psychotic, excess, nodule growth, and that's psychotic as well. Totality, as you can see, there is enlargement of thyroid gland, polyuria, there is weakness, chilly feeling, desire salty with a past history of tuberculosis, recurrent ringworms, artistic hobbies, and predominant tubercular symptoms. Now, few medicines which I like to compare with you before coming to the prescription. Do remember, my friends, one of the very useful medicines in these kind of conditions where there is a glandular enlargement with chilliness, do remember Cistus canadensis. Cistus is a very chilly medicine with glandular enlargement. Remember, many authors compare Cistus with Sorinum and Silica for its chilliness. But in case of Cistus, whenever you come across glandular symptoms with a lot of chilliness, Cistus is your topmost remedy. Second medicine, my friends, the first name of the first medicine, Cistus, C-I-S-T-U-S, Cistus canadensis. And that is prescribed in 30C to 100C. Remember, glandular enlargement in a very chilly patient when a well-selected medicine fails. And chilliness to the grade of Sorinum and Silica, your chilliest medicines. The second medicine, my friend, which can come up in this case especially is Spigellia as well. Because you understand Spigellia is a left-sided remedy. And in Spigellia, you can have the thyroid gland enlargement and pain radiates up to the head. So Spigellia can come in as well with the radiation of the pain to the head. And the chilliness you can find with Spigellia as well. They're very chilly, they're shuddering to that extent. So Spigellia is an important medicine. Do remember the third medicine which can come up is Merck bin iod, because you understand iodum group has a very good affinity for the thyroid gland. But in case of Merck bin iod, it's especially left-sided. So whenever you come across left-sided glandular symptoms in a mercury constitution, always remember Merck bin iod is a very useful remedy to come up in those cases. But in this case, my friends, we started off our prescription with tuberculinum. As you can understand, there are a lot of tubercular symptoms. The chilliness, artistic hobbies, creative, the crave for fresh open air, but it makes them sick. Past history of tuberculosis, bleeding gums is tubercular. Very weak and fatigue as well. And that's important. With the desire for salty, that's a feature of the tubercular miasm as well. So tuberculinum was the first choice of prescription in that case. And tuberculinum 200C was started with. Also, my friends, I want you to take a note for a very interesting medicine. You'll find this in Borica in the relationship of tuberculinum. That is tuberculinum aviare. It's the tuberculosis of chickens. AVIARE, tuberculinum aviare. And that is a very useful medicine which is prescribed in cases where you have a good tuberculinum totality, but patient comes to you in a very acute stage. So patient comes to you with a lot of sneezing. Patient comes to you with an influenza-like symptoms, like a bronchitis-like symptoms, especially in this pandemic season as well, where they are having like an acute cold, we're having flu-like symptoms, but you're absolutely sure that this is a tuberculinum totality. But you're thinking, should I prescribe a Nozode? What it may flare up. And in those cases, my friends, you can start off with aviare, and later on, when the acute state has subsided, you can prescribe a tuberculinum in potency. I want you to please put a note for this medicine, tuberculinum aviare, where you have flu-like symptoms, cold symptoms, feverishness, debility, loss of appetite in a tuberculinum constitution. You'll find this in the relationship of tuberculinum in Borica's Medica. So this was not really acute, so that's why I didn't start off with aviare. But if you have acute symptoms, acute cold in a tuberculinum constitution, do remember that fantastic medicine which is prescribed in 30C and 200C. So we started off with 200C for tuberculinum aviare, and we didn't need much in that case. 200C had helped. They had done an FNSE which showed the thyroiditis. You can see here it's mentioned findings are consistent with subacute thyroiditis. So this was done with the radionuclide thyroid scan, and the FNSE shows about Hashimoto's thyroiditis. So this was before the treatment. You can see the date, 11th of November 2014. And impression is also the same, thyroiditis, thyroid nodule. And so he came to us about 3 months, he took the treatment. You can see 29th of January 2015, impression ultrasound shows a normal ultrasound completely. So there is no thyroid symptoms in that case as well. So you can understand how we put together the symptomatic totality and the miasmatic totality. I got the symptomatic totality of tuberculinum because he was chilly, because he had desire for salty, because he had a past history of tuberculosis. So I had symptomatic totality on one hand, but I confirmed my symptomatic totality with miasmatic totality. Why? I got bleeding gums, tubercular. I got an artistic, creative person, tubercular. I got a person who gets bored easily, tubercular. Now I'm combining the symptomatic totality with miasmatic totality, and I'm more confident in my prescription. My friends, whenever you come across cases where you feel stuck, where you feel there is not much change, do always remember your miasm to fall back to. And whenever you feel like after your repertorization, after you have done the totality, you find you're stuck with sulfur, you're stuck with thuya, you're stuck with mercury. Now look at the miasmatic totality. You see his hobbies, you see his nails. I shared with you nails in an earlier session. You'll see he's got very brittle nails which breaks easily. You see his hobbies are adventure sports, kickboxing. So it's more destructive, aggressive hobbies. And that hobby, that nails confirms that yes, it's a syphilitic miasm. Now confirm that with your prescription. You see sulfur, thuya, mercury coming up. What's your miasmatic totality? Syphilitic. What's from the symptomatic totality? Tell me a syphilitic medicine. Mercury coming up. You put symptomatic totality on one hand, you put miasmatic totality on one hand, you combine, you get the prescription. So my friends, miasm is not one thing which will keep you separate, which is a box in a corner of the room. No, implement it in your totality. My friends, I'm not sharing with you processes on any new methods to deviate from your practice. Do whatever you're doing, just implement miasm with your prescription, and I'm sure you'll find avenues in cases where you are stuck. So that's about your thyroiditis. I'd like to take you to another very interesting topic, is osteoarthritis. Obviously, we're not here discussing about remedies for osteoarthritis. That will be an endless list. It's not possible to discuss that in this limited frame of time. But I'd like to share with you an interesting aspect about the miasmatics of osteoarthritis, which I think is quite important for prescription. And as we go along, I'll be sharing with you a few interesting clinical tips which I've learned ancestrally as well. Psoriatic osteoarthritis, remember it's more functional origin, my friends. Inflammatory changes, osteitis, initial stage of osteomyelitis. So any inflammatory changes which are there, changes. Muscle cramps, which you can find along as well in psoriatic miasm as well. So cramps, initial starting of or onset of joint symptoms where it's more inflammatory changes, functional origin, but there are no structural deformities yet to account for. Psychotic extremities. Do remember, my friends, you'll find in psychotic, there's a lot of swelling in the joints. I'll share with you pictures in some time. There's a lot of edema in the extremities as well in psychotic osteoarthritis. So a lot of swelling in the joints, lot of gouty nodosities as well you can find with osteoarthritis, and that's important. Syphilitic osteoarthritis. Whenever you come across syphilitic osteoarthritis, you will find there's a lot of degenerative changes. Think of cases of osteomyelitis where there is bone destruction, sequestrum formation. Think of bone pains. Do remember, my friends, neuralgic pains are psora. Joint pains are psychotic, whereas bone pains, pain in the shaft of the bones. So somebody is telling you, my entire leg is paining. So in the entire shaft of the bones, there is pain, syphilis. I repeat, neuralgic pains are psora. Joint pains are psychosis. So pain in the joints, whereas bone pains, pain in the shaft of the bones is syphilitic. So whenever you have osteomyelitis with bone destruction, malignancy of the bones with bone destruction, those are more evidently syphilitic pains. Tubercular, my friends, remember weakness of joints. Sometimes you'll come across cases where the joints turn easily, they get easily sprained. Think of remedies like carboanimalis, think of remedies like lead and paul, where you have easy spraining of ankles, easy spraining of knees. That weakness of the tendons and ligaments is generally tubercular. Nodular growths of glandular origin. So sometimes you can find glandular swelling with the joint pains, and that is more often than not a tubercular miasm. So somebody has a hip joint pain with enlargement of the inguinal glands, and that is tubercular miasm, my friends. Psoriatic pains, as I shared with you, is more neuralgic, so sore, bruised, pressing pains. Think of the pains of arnica, think of the pains of eupatorium, the soreness what you have. That sore, bruised pains is a feature of psora. Ruta as well. This is a very classic picture, my friends, of psychosis. Look at the hand, if you can see, and this is also important. I shared with you in the earlier webinar about look and diagnose the skin. Here, if you see the huge swelling in the joints, psychosis. You can see to a certain extent there's a lot of deformity as well. If you see the fingers, there's deformed, like a swan neck deformity. So the huge amount of swelling in the joints is psychosis. But whenever deformity comes to that extent, syphilis joins in. My friends, this degree of huge swelling, you'll find this with Medorrhinum. You know, in Allen's, if you read Medorrhinum, you'll see the joints are swollen like wind galls. So there's a huge, huge degree of swelling in the joints. And that's important for Medorrhinum. With the swelling, the puffiness, puffy knuckles that you can find with Medorrhinum, it is classically shown in this picture here. Psychotic extremities, incoordination, anatomical, functional incoordination. Rheumatic and gouty diathesis is psychotic. As I shared with you, it's more the joint pains which is psychotic. Do remember that. Syphilis, there's a lot of degenerative changes. In today's world, people come to us with loads of investigations. But my friends, that is sometimes very unique and useful in diagnosing the miasm. Think of a patient who has come to you with an X-ray or an MRI which shows a lot of degenerative changes in the spine, degenerative changes in the knee. You have to think of a syphilitic remedy there. Degeneration, destruction, syphilis. Think of remedies like Kali iod. Think of remedies like Phytolacca, Calcaria fluid. My granddad always told me that your top 3 remedies for a syphilitic degenerative osteoarthritis: number 1, phytolacca; number 2, Kali hydroiodicum; and number 3, calcarea fluor. These are your top remedies for degenerative osteoarthritis. If you see in this picture, purpura, redness of the skin with hemorrhagic manifestation with joint pains. My friends, if you recall, perhaps you have heard from me some other session that a wonderful medicine for this condition is streptococcine. In streptococcine, you have joint pains which are aggravation first motion, better continued motion. Along with that, you can have redness as well in the joints. Streptococcine is a hemorrhagic remedy. If you make a triangle for streptococcine, on top of the triangle, joints where you have aggravation first motion, better continued motion. When you look at the streptococcine joints, you'll see the joints are very red, swollen, like inflammatory changes. So on top of the triangle, you have joint pains, worse from first motion, better from continued motion. Second side of the triangle, you have any hemorrhagic symptoms. You can see here, like the purpura, you can have bleeding gums, you can have blood with the stool in streptococcine. And third side of the triangle for streptococcine, you'll have heart. Remember, for rheumatic heart disease, it always licks the joint, it bites the heart. So in heart, you can have a palpitation, you can have a chest pain, which is a feature of the tubercular miasm. As well, the palpitation is tubercular. So this is a classical description of streptococcine, and I want you to understand this remedy where you have joint pains, typical modality like Rostock's, worse first movement, better continued movement. Second side, you have hemorrhagic symptoms, redness or bleeding gums or bleeding with the stool. And third side, you have heart symptoms in terms of palpitation. And you can add a fourth side to streptococcine. You have a recurrent sore throat in streptococcine. Either a history of sore throat in childhood, like a strep throat, or you can have recurrent sore throat in case of streptococcine as well. It's a fantastic medicine for that condition. So do remember that is tubercular. Whenever you have redness across the joint with joint pains, do remember this fantastic medicine, streptococcine. You all obviously have apis and belladonna, which can have inflammatory changes with joint pains. Apis can have a red rosy appearance. Belladonna can also have a redness. But sometimes they're not too deep acting to take care of this kind of condition. And in those cases, you'll need help of a nosode, which is streptococcine. Psoric sensations, my friends, do remember, sometimes in psora you can have the neurasthenia, so tingling, numbness, formication, that you can find with psora. So psora, as I shared with the neuralgic pains, are psora, so heat of the palms and soles, you can find that with psora. Numbness, tingling sensations, you can find with psora as well. That's quite classical for a psoric pain. And cramps as well. That's quite classical for psora. If you see here in this picture, my friends, joint pains, whenever you can find stitching pains, do remember that psychotic. And you see in this picture, gouty concretions, like gouty nodosities in the joints. If it's very sensitive to touch, do remember colchicum. Very sensitive to touch this. So it touches the elbow, oh my God, you know, that kind of sensitiveness. Patient screams with pain. So that kind of sensitiveness you'll find with colchicum. But if there is not that degree of sensitiveness and that degree of nodosities are there, other gout medicines can come in. Do remember a very interesting medicine, ammoniacum phosphoricum, in the case of gout with this kind of nodosities. Have a look later on in your boricae, ammonium phosphoricum, where you have this kind of gouty nodosities. It sometimes affects the fingers, but even in the elbows and other areas, it can affect as well. But the character of the psychotic pain, as I shared with you, it's more stitching character of the pain. Syphilitic pain, my friends, burning, bursting pains are syphilitic. So whenever somebody comes and tells you, I have burning in my joints, my friends, the top remedy we should always think of is medurinum, where you have burning in the joints. In medurinum, you can have the restlessness like zincum, and you can have the burning like sulfur. So whenever you have that degree of burning in the joints, do remember, number one remedy is medurinum. Number two is capsicum as well. Capsicum can have joint pains with a lot of burning, like cayenne pepper is rubbed on that parts. So burning in the joints, which is syphilitic, Your top two remedies for that is capsicum and rhinum, my friends. Tubercular extremities, cramps in the lower extremities. Again, to start with the sora, when it becomes persistent and recurrent, tubercular joins in. Sora is always aggravated in winter. Aggravation between sunrise to sunset. So daytime aggravation is sora, or early morning aggravation is sora. But sora is better in the summer. Do remember, joint pains are better from heat, better from natural discharges, urination, sweat, menstruation. That always makes sora better. That's important. Hot application makes sora better. Joint pains, better by hot application. I'm sure you know your remedies. I'm sure you know Rostox. But my friends, do remember, whenever your Rostox fails, do remember radium bromide. Joint pains which are better by heat. Radium bromide is also a very important medicine. Psychotic modalities. Worse from cold, worse from damp. That's quite classic. Do remember, my friends, joint pains which are worse in damp weather. My topmost medicine for that is Kelly iod, followed by Phytolacca and Rostox. Your top three: osteoarthritis worse in damp. I repeat, Kelly hydroiodicum, Phytolacca, Rostox. Sometimes what you can have in case of psychosis, they're better from movement. And my friends, I want to share with you, this is a very interesting clinical tip I learned from my ancestors, and I want you to please take it down. Whenever you come across cases where you have aggravation first motion, better continued motion, I'm sure you'll come across loads of cases in this world with osteoarthritis where the patient tells you, I'm worse waking up in the morning, but as I continue to walk, my pains are better. Aggravation first motion, better continued motion. I'm sure you know about Rostox. I want to give you 10 medicines, my friends, for aggravation first motion, better continued motion. And I'm sure I've learned this as an ancestral tip. You know, you look up in the repertory, you'll come across 100 medicines. Doesn't help. But this is from my ancestral heritage. I want you to please take this down. Aggravation first motion, better continued motion, just for joints. My number 1, anacardium. Number 2, conium. Number 3, capsicum. Number 4, calcaria fleur. Number 5, Rostox. Number 6, pulsatilla. Number 7, lycopodium. Number 8, streptococcine. Number 9, radium bromide. Anacardium, conium, capsicum, calcaria fleur, pulsatilla, Rostox, lycopodium, streptococcine, radium bromide, and ferrum metallicum. Ferrum metallicum. I'm sure you got all the 10. I repeat, anacardium, conium, capsicum, ferrum metallicum, Rostox, calcaria fleur, radium bromide, streptococcine, lycopodium, pulsatilla. And my friends, I'm sure if you want to take back just one thing from this session, this should be it. I'm sure you'll come across psychotic remedies, but do remember, whenever you come across aggravation first motion, better continued motion, look at these 10 remedies, now do a comparative Medica and differentiate. And I'm sure, go back to those cases where you're stuck with osteoarthritis, these remedies will definitely come to your rescue. You know, those who have heard me earlier, who have seen my videos, you understand I always try to share with you practical understanding. I don't share with you dreams and delusions, because practical world will not tell you always that. But you'll come across cases of osteoarthritis where you'll be stuck. Believe me, try these modalities and I'm sure you'll get success. Coming back to the psychotic modalities, you can see here, it's like a stitching pains which you find with psychosis. Better by continued movement, as I shared with you. Better by slow motion. So, you know, I have a frozen shoulder. Slowly I move, I feel it's better. Ferrum metallicum, pulsatilla. Better by slow motion. That's important. Better by rubbing. So better by massage. A lot of patients will give you that. Do remember, you have that in calcaria fleur. Calcaria group in general is better by massage. You have that in plumber metallicum. You have that in magphos as well. Joint pains, whenever it's better by massage. I repeat, calcaria group, especially calcaria fleur, plumber metallicum, magphos, and phosphorus as well, where joint pains are better from massage and rubbing. Syphilitic extremities, I'm sure you know this, worse at night, sunset to sunrise. You know, I want you to read later on a remedy called Kali iod, Kali hydroiodicum, where you have psychosis and syphilis in equal degree. You have huge swelling of the joints, which is psychosis. You have damp aggravation, which is psychosis. But at the same time, you have degenerative changes, which is syphilis. At the same time, you have night aggravation, which is syphilis as well. So Kali iod is a wonderful remedy where you have psychosis and syphilis combined together. And you can understand a case, think of those cases which are contemplating knee replacement. And you can help those with Kali iod, where you have huge swelling in the joints. They go to the conventional osteoarthritis physician to get tapping of the joints to remove the fluid, but doesn't help, it comes back. And now they're contemplating on knee replacement. And I'm sure you'll handle those cases with Kali iod. And there you have the aggravation rest, better by movement of Kali. But the damp aggravation, which is psychosis, the huge swelling in the joints, which is psychosis, the night aggravation, which is syphilis, and the degenerative changes, which is syphilis. And that you have with Kali iod, and that is a syphilitic modality, worse at night. Tubercular extremities, remember, periodically tubercular extremities comes. Across the subcontinent, you'll come across cases where people tell you, I have a new moon, full moon aggravation. I'm sure in the Indian subcontinent, my Indian friends joining in can corroborate to that. Patients tell you that whenever it's new moon, full moon, my joint pains get aggravated. So periodically, in the West, those who are joining in across the globe, people are telling you in 15 days, 2 weeks interval, the pain comes back. So it's a periodic aggravation. Sometimes it's related with the moon phases. My topmost medicines for that, my friends, Calcaria fluid is your topmost remedy for new moon, full moon aggravation. I'm talking about osteoarthritis. I'm not talking about anything else. So joint pains, new moon, full moon aggravation. Number 1, Calcaria fluid. Number 2, Thuya. Number 1, Calcaria fluid. Number 2, Thuya. Number 3, Silica. So whenever you have joint pains which are worse in the moon phases, do remember Calcaria fluid, do remember Thuya, do remember Silica. Calcaria fluid and Thuya are your topmost remedies for an osteoarthritis case which has a periodic new moon, full moon aggravation, which is in turn tubercular because of the periodicity. And remember, for tubercular miasm, it's always recurrent, where you have the sodic hypoimmunity and you have the syphilis destruction of immunity. So there is always a recurrent onset of symptoms. It comes back periodically. It comes back every summer. It comes back every winter because the immune system is completely compromised and destroyed. So it's coming back recurrently every alternate month, every alternate season, every alternate year. And that's tubercular as well. If you see this picture as well, huge swelling in the joints, nodosities. I shared with you a medicine earlier on, Amon Phos, where you can have this swelling of the joints, gouty nodosities of the joints when your well-selected medicine fails. Do remember, my friends, whenever you have this huge swelling of the thumb joint, and the very useful lesser-known medicine is Hedeoma, 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 where you have specially pain in the thumb joint, and that's very classical. You can see in this picture how the thumb joint is swollen, and you can have that with Hedeoma, where you have this kind of huge swelling and pain in the thumb joint. It's specifically suited for thumb joint pain. But you have huge swelling in other joints as well, especially the finger joints. Do remember you have that in Amon Phos, but sometimes you can have erratic finger joint pains. Sometimes it's in this finger, sometimes it's that finger, sometimes it's this finger. So pain is radiating between finger joints, but that is coliphylum. Do remember finger joint pains, which is migratory, coliphylum. Joint pains in the fingers with huge swelling, Amon Phos. Thumb joint pain, that is specifically Hedeoma. In case of coliphylum, do remember ESI, coliphylum, erratic, so migratory pains between the fingers. S for stiffness, so the finger joints are stiff. I for intermittent, pain comes and goes. Erratic, stiffness, intermittent pains, that's classical for coliphylum. But finger joint pains, that's a classical area of action for coliphylum. Again, you can see the psychotic extremities, swollen, psychosis. Redness is there, tubercular joints in there. Psychosis, sometimes you can see heart is affected as well in psychosis. So that is quite important. And you can find heart affected in psychosis mostly. As I shared with you, a remedy, streptococcine. You can see this picture. You see the stiffness in the joints. To start with the psychosis, but sometimes this can start after a sprain. You know, you try to lift something heavy and your tendons become weak, tubercular miasm. The remedy for that, my friends, I want you to put a note for that, cannabis sativa, where you have finger joint spraining, and that is resulting in the contraction and contracture. Cannabis sativa. So lastly, we'll finish up, as I shared with you, SORA, more functional changes. Remember, neuralgic pains are SORA. Tingling, numbness, that is SORA. Daytime, early morning aggravation is SORA. Winter aggravation is SORA. And warmth amelioration is SORA. Psychosis, do remember you have stitching pains as psychosis, lot of huge swelling in the joints is psychotic, gouty nodosity is a psychotic. Daytime aggravation is psychosis, sunrise to sunset. Damp aggravation is psychotic, huge swelling in the joints is psychosis. Sometimes this kind of stiffness in the joints is psychosis. As you can see in this picture here, you can have that with causticum. You can have that with cannabis sativa after a sprain. You can have that with ginseng, rustox, where you have this degree of stiffness in the joints. That is psychosis. Syphilis, as I shared with you, pain in the shaft of the bones is syphilis. Night aggravation is syphilis. Burning, bursting pains are syphilis. At the same time, degenerative changes in the hip, in the knees is syphilis. And lastly, my friends, whenever you have joint pains with a lot of exhaustion, with a lot of muscle cramps, that is tubercular. You have new moon, full moon aggravation, periodic aggravation, that is tubercular. Joint pains with a lot of wasting, like rickets, marasmus, where you have an emaciation with the joint pains, like ledum, plumbum, graphitis, that is tubercular, where there is emaciation of the affected part, and that is a tubercular feature. So, you know, my friends, this is just one way of sharing with you, in a nutshell, a fragment of what we have discussed in the course with THA. And I'm sure you'll take back interesting clinical tips. You'll take back interesting aspects about joints prescription from this discussion, as well as I shared with you a case where you can implement prescribing in a case of thyroiditis. I'd like to share with you a few words about our program. It's a very practical program, my friends. One of the major factors why we took up miasms to share with you as a course. We have a lot of other courses running, but I took up miasms to start up because it's a very debatable topic. People always try to avoid it. It's like the elephant in your room. Nobody addresses it. So you'll always be thinking that why we do not implement miasm. But in the course of the Homeopathic Academy, we have tried to implement the most easiest and simplest way of understanding miasm. As I shared with you, our approach is MTech. M for miasmatic totality, T for symptomatic totality, E for essence, K for keynotes. So you understand the miasmatic totality and symptomatic totality, two sides of the same coin. We start in this course with different modules. We start off with understanding the basic criteria of each miasm, SORA, psychosis, syphilis, tubercular. Then we go on to the emotional aspects of each miasm. Then we go on to the particular features head to foot, so that you can understand practically with each symptom the patient gives you, you can implement what miasm is this. Finally, we go to common clinical ailments which we'll get in practice: osteoarthritis, asthma, gastritis, emotional components, cancer. We'll be trying to dissect that miasmatically in different modules. And lastly, we are finishing up the session with two cases of thyroiditis, cases of psoriasis, where we share with you how practically we have implemented miasm in our practice. But last but not the least, one of the most important factors of the curriculum in the THA is miasmatic weightage of remedies. We took up different medicines from Borica's Medica, we put it up and we dissected miasmatically a few of the polycres so that you can understand what is which miasm. And we give you a list of the most important miasms, most important polycres and their miasmatic weightage, so that you can implement that in your practice as well. So do join in, and I'm sure you'll learn a practical way of miasmatic prescribing. More importantly, the miasmatic ancestral heritage, which I've inherited over 4 generations. And as I shared with you, what I can do, I'm sure you can do as well.
Thank you so much, sir. This webinar was very informative. I would like to request all our dear learners to comment in the chat box with their questions now. We will begin the question and answer session in a minute. And until they are doing so, I would like to inform our learners that THJ has come up with an offer. And on the right side of the screen where you're writing your questions, there is an offer section, and you can see the offer on the course of Learning the Art of Rapid Classical Miasmatic Prescribing. That is the course by Dr. Saptarshi Banerjea on THJ. So that's a 30% off, for which you can use the code FD30 at checkout on our website. Another important thing, you can see a section of poll on the chat window, and I would request you all to please send us your reviews on our webinar today. So let's take up the question and answers before we run out of the time. Yes. So, sir, a learner wants to know anatomical abnormalities like 6 fingers. Can it be a syphilitic miasm?
Good question. To start with, that is psychosis, because excess is always psychotic. But sometimes you can get deformities as well with that, then syphilis joins in. But in most cases, it's a psychotic miasm.
Yes, sir. And thank you, sir. And another learner wants to know if there is a full thickness tear to the ACL ligament, which miasm we can consider?
That's more like an acute condition, like a ligament tear. So that's more like an injury. If there is long-term effects from that, like the weakness of the knee joint, or there is lack of mobility of the knee joints, you always think of the tubercular miasm, because there is that laxity and weakness of the ligaments, which is a feature of the tubercular miasm.
Thank you, sir. A learner wants to know if there is degenerative changes in articular cartilage, do they regenerate after syphilitic medicines, or they just relieve it?
Good question. There are 2 answers to that. Part 1, if you think the age is quite advanced, so there is irreversible changes, you cannot do much. But sometimes if degenerative changes start in a very young age, if the vitality is good, if the susceptibility is good, with a correct syphilitic remedy, you can help in the regeneration as well. So it depends on the age, the vitality as well, which is the deciding factor.
Thank you, sir. Another learner wants to know what is... Just a second, I've missed the question. Yes. So if a patient has multi-miasmatic expressions at different levels, how do you approach that?
We have discussed that exactly in our module over the 9 modules, how we approach a multi-miasmatic case. As I shared with you, you look at the hobbies, you look at the nails, which is a surface miasm, you look at the symptoms and decide which is the surface miasm. So look at the present complaint and you can decide accordingly. If it's a one-sided case, look at his emotional component, look at his hobbies, look at his nails, and you can decide on that.
Thank you, sir. A learner wants to know if there is muscle pains, especially in the shoulders, frequently happening, which miasm should we consider?
That's a very vague question, to be honest. You have to understand the character of the pain. If it's a lot of stiffness, I'll say it's psychosis. If it's more tingling and numbness, sora. If it's a lot of burning pains in that area, that's more syphilitic. Always try to get particular modalities or sensations, and then you can understand or dissect the miasm very clearly. If you get just like a aching pain in the joint, it gives you a very vague symptom, and it will be a very wrong miasmatic dissection in that case.
Thank you, sir. A learner wants to know, what if Kali iode fails and aggravates the case in a knee replacement case? What should we do next?
In Kali iode, always start with 12C. Other remedies which can thought of in Kali iode fails, Phylacca, Stillingia is an interesting medicine. So in a syphilitic osteoarthritis, Stillingia helps in many cases. So take a note of those.
Thank you, sir. If there is cervical rib present and the patient is suffering with thoracic cage pain radiating to the right hand, what should we do?
It's a more neuralgic pain, so you have to think of a neuralgic medicine. Tingling, numbness can be there. Sometimes remedies like Paris quadrifolia helps. Paris is a remedy where the pain starts from the cervical region and radiates down to the hand. So think of those remedies, but you have to think of a neuralgic remedy because of the sometimes tingling numbness is there.
Thank you, sir. A learner wants to know which miasm is responsible for sciatica.
Again, that's a good question. Sometimes in sciatica, you can get a lot of degenerative changes. If that's quite a lot present, you have to think of a syphilitic remedy. If the tingling numbness is the predominant component, you have to think of a psoric remedy as well. So assess accordingly, which is the more prominent feature. If there's a lot of neuralgic symptoms, try to think of a psoric remedy. If changes which is compressing the nerves and causing the sciatica pain, think of a syphilitic remedy. But sometimes in those cases, you start off with a psoric remedy, and then to help or completely resolve the process, you have to think of a syphilitic miasm.
Thank you, sir. A learner wants to know, induration of lymph glands below ear, can Cistus canadensis used in chilly person with no thirst?
Absolutely. Thirst is not a criteria for Cistus prescription. Patient has to be chilly, and along with that, there is the glandular enlargement. So those two are the important factors for prescription.
Thank you, sir. A learner wants to know, if a diabetic patient has joint pains and tingling, but there is no numbness crawling in the muscle, which miasm is it?
Tingling, if it's there, I'll say it's still psora. So if it's the tingling is a predominant feature, I'll say it's still the psoric miasm. But again, diabetes cases are quite multimiasmatic. You have to assess which are the predominant symptoms and decide accordingly. But if tingling is a predominant feature, think of a psoric remedy. Always in these cases, my friends, whenever you are stuck, try and understand what is the present complaints, decide the surface miasm accordingly. So, that's the only way to go ahead with that. Don't get confused when you have a variety and spectrum of symptoms. Pick up the major important points which is troubling the patient, not which you think is important, but which is troubling the patient, and decide the surface miasm accordingly.
Thank you, sir. A learner wants you to share a few words about pseudopsora.
Pseudopsora is the tubercular miasm. As I shared with you, it's a combination of psora and syphilis. So you have the hypoimmunity of psora, you have the destruction of immunity of syphilis. So sometimes whenever you have recurrent persistent features, that's a tubercular feature. And the key word of tubercular, I shared in the earlier webinar as well, is dissatisfaction. So they crave for things which generally makes them sick.
Thank you, sir. What is the miasm in ADHD? Learner wants to know.
Good question. ADHD, if you divide it, attention deficit, so that's the incoordination of psychosis, as well at the same time you have the physical restlessness, which is psychotic as well. So in most ADHD cases, you'll find a predominance of psychotic miasm. But again, if you have a lot of aggressive component, you have a lot of impatience and stubbornness, syphilis and tubercular miasm joins in. But ADHD as a medical diagnosis is psychosis, obviously, because of the incoordination and restlessness.
Okay. A learner wants to know, what is the role of ONO salt in managing arthritis?
I don't prescribe that to be very often. I haven't had much success. As I shared with you a lot of interesting clinical tips, I'm sure you'll have better results with those remedies other than ONO salt.
Thank you so much, sir. As we are running out of time, let's just wind up here. And so I would like to thank you, Dr. Banerjea, for such an informative and enriching experience. I would like to extend a very warm gratitude on behalf of THA and on behalf of the BGen group. I apologize to those whose questions I couldn't take up due to shortage of time. Thank you so much, sir. Would you like to say something to our learners?
Thank you those who joined in. I'm sure you enjoyed the session. If you do get a chance, do join in THA's miasmatic prescribing. As I shared with you, is a very practical and simplified learning of miasms with a lot of animations and pictorial representations. So I'm sure you'll be thrilled educationally as well as practically as well. So do join in for those sessions. Thank you.
Thank you so much, sir. And I would like to thank you all learners, the homeopathic fraternity who joined us here today, and of course, Team THA, who has been working hard to make this webinar as well as THA a success. So again, don't miss out on the wisdom by Dr. Banerjea himself and enroll in his course. Thank you so much. Have a great day. Keep learning and keep improving.
Thank you.